All right, hi guys. We have a very nice lady. She already had liposuction of the front done before, and now she's coming back for second surgery, right? We still have to do a little bit more on the side. You can see that we still have a little bulging on the inside, little bulging on the inside, a little bit more bulging right here. Now, she also mentioned something you can see here on the back. Can I get you to turn just a little bit? That's perfect. So you can see this, she feels a little bulge. Now, here's a problem with this area. Right here, there's an ankle joint, and you can also feel this little sludginess right here on the side. What happens is, my understanding, it's not really lipedema. It's an extension of the ankle joint. The capsule loosens up and forms like basically a fold. And usually it gets worse when people walk. The swollen, the joint gets a little bit inflamed, more fluid inside of the joint, and that swells up. And if you take anti-inflammatories or lift the legs up, then this gets better. So this may be not just lipedema, it could be the capsule of the joint. And the problem with the capsule of the joint, you can't really liposuction it. If you get in it, you actually can create infection in the joint, and nobody wants that. So I have to be really careful. If there is something on top of the capsule and it's a fat and I can remove it, I will. But I have to be really careful not to make sure to get inside of the capsule. So that's that. Now, another thing I wanted to talk about the complications of lipedema surgery. I wanted to show you something. So we did liposuction on the front, and you can see those lumpy bumpies, right? It's a little bit irregular. It's gonna get better once we liposuction more, and we will talk about skin tightening. But here's the thing that most people don't talk about. Everybody wants to have all the lipedema fat removed, and in some cases, it's really not possible. Here's why. If you have the skin, you have the fascia, and then you have the muscle. We just had this conversation, right? So you can have normal fat above and below the fascia. When we do liposuction, we do it separately from the superficial fat and the deep fat. Here's the issue. Whenever you have severe lipedema, and when I mean severe lipedema, I don't really mean you're really huge necessarily. It's just a lot of your normal fat replaced with lipedema fat. And if a lot of normal fat got replaced with a lipedema fat, and I go in and I liposuction everything, now you have nothing separating skin, fascia, muscle. Now, if all of the fat is gone, they're all going to connect together, and you're going to have a very, very visible, deep dimple that most people don't like. So remember that we're doing lipedema liposuction surgery for the purposes of pain, and we'll remove as much fat as I can to improve the pain symptoms. If I go haywire trying to remove all the lipedema affected fat, then your leg will end up with multiple divots. So you're going to be maybe a little bit less painful than with regular lipedema liposuction, but then you won't be able to show your legs because it will look completely indented. So I divide those lipedema nodules in two categories. The one that you can see and the one that you can feel. If they don't bother you and you cannot see them, I would say leave them alone. But if they don't bother you and you can see them, then I can make small incisions and make them a little better. So let me give you an example. We'll look at the back right here. So here's what we marked, right? There's a little area of that kind of looks like a little lipedema prominence. You may be able to see it. So if I go in, I have to make a small incision, and I have to do a little lipo, maybe a little excision of the fat. The downside of that, instead of a little bulge, she may end up with a little indent. And what's better? I don't know. But this is something that we discussed before the surgery. Also, another discussion we had about the catheter, right? The bladder. So we used to not do bladder catheters. Then we went to those little cups that help ladies to pee, but about 70% of people hated it. And now we went back to putting Foley catheters in. And we spoke to urology just to make sure it doesn't increase the risk of infection. And the idea is that if the catheter stays less than 24 hours on average, then the risk of infection increases really negligible. So the idea is if the patient had the surgery and then they have to go to the bathroom because we put a lot of fluid in and they peed out. So they have to go to the bathroom after the surgery the same evening. They can be lightheaded, they're at higher risk of falling down and so forth. So we keep the catheter overnight so they don't have to think about it. In the morning, about 6 or 7 a.m., remember, because these patients stay in the hospital, on the hospital level nursing care. The nurse will come in early in the morning, take the catheter out, and then it gives the opportunity for the patient the whole day to kind of feel better, recover from anesthesia, and hopefully have the less risk of falling down and so forth. So this protocol of short-term catheter, Foley catheter in the bladder after the surgery has proven to be more effective and much better tolerated by the patient than before. All right, too many things in one video probably, right? So let me mark the lady, and we'll see you in the next video.